Welcome to PALS. In today's lecture, we'll be considering the cubital fossa. The cubital fossa is that depression at the anterior section of the elbow joint. Now, in considering this topic, we'll break it into subsections. Now, we'll first of all look at the position. We'll consider the position of this fossa. Now also consider the shape. We will look at the various features. There are a number of contents. We want to look at the contents. And then we'll take a little look at the applied anatomy. So 1, 2, 3, 4, 5 will serve as a guide in our lecture today. First, let's take the basic introduction. The fossa is an intermuscular space. We have it happening at the junction between the forearm and the arm and the forearm. Now, at this point, we're seeing a number of muscles. We're seeing the brachioradialis muscle running from this point. We're seeing brachioradialis muscle that peak origin from the supracondylar region in the lateral supracondylar region. We see the brachioradialis running downwards. And the next muscle of importance in this introduction is the Pronator Terrace, which is one of the muscles in the flexor compartment of the forearm. So the muscle peaks origin from the common flexor origin, that is the anterior surface of the medial epicondyle. And then we know how it ran. It ran an oblique course going towards the radius to radial tuberosity for its insertion. At this point, it gets overlapped by the vertical brachioradialis. So the space we are considering today is actually the space between the brachioradialis at this point, that's the brachioradialis on the lateral side, and the Pronator Terrace, that's the Pronator Terrace on the medial side. So this space is the space. It's important because there are a number of structures that actually localized at this point. We'll be seeing some tendons that are important, some nerves, and then also some vessels, a vessel that's a brachial artery that will eventually divide into its terminal branches. So peak will come as a way of giving us the position. We said that the position, if we need to go straight to the position, we just know that the position of the cubital fossa is at the anterior surface of the elbow joint. Now, the shape of this fossa is triangular. As you can pick out from our earlier chart here, it is triangular in shape. It has a base and an apex. The base actually faces superiorly, while the apex faces inferiorly. Now, the features. This fossa has a number of has some features. One, it has boundaries, walls. It has boundary or borders. You can call them borders, you can call them walls. It has borders, it has an apex, it has a base, it has a floor. It has a floor. So these four features will be considered in describing the fossa. So by way of repetition, we said it has borders, it has an apex, it has a base, it has a floor, and then additionally also, it has a roof. It has a roof. Now let's pick out the borders. We'll introduce the features and then subsequently give details. Now, the borders, we have 3 borders. The borders are 3, and these borders are: 1, we have anterior border, We have anterior border. We have anterior. Okay, let's go direct okay. Let's start with the borders. The borders are 3, and these are the borders. We have the lateral border. We have the medial border, and we have the superior border. Actually, another name for the superior border is the base. That's the base. The base. So let us try and pick out these areas from the diagram we have. Already, when we look at the diagram we have here, the first diagram we have here, we can pick out these borders. Now, this is the medial border, the border that is bounded by Pronator Terrace. And then this is the lateral border, the border bounded by brachioradialis. And now we have these two parts. At this point, we are saying this is the point for medial epicondyle, and this is the point for lateral epicondyle. We actually see an imaginary line connecting these 2 points. So this imaginary line actually forms the upper border or the base. So we have, for the borders of the cubital fossa, we have the lateral border, we have the lateral border, please, we have the lateral border, the medial border, and the superior border or the base. I will give more information on the structures that form these borders, but let's first identify the various features. Next, the floor. The floor is actually the muscles that form, the muscles that we eventually see around the area being considered. Now the roof will be the structures that we can say forming. In fact, the floor can be said to be the posterior relation, and the roof can be said to be the anterior relation. Now let us consider the structures that form each of the following features. Let's start with the borders. In the borders, we start with the medial border. The medial border is formed by Pronator Terrace. That's the Pronator Terrace. The part of Pronator Terrace, when we also look at it here, we'll see the Pronator Terrace. That's the Pronator Terrace moving down. So the part of Pronator Terrace forming this medial border is the lateral border of Pronator Terrace. So the medial border is formed by the lateral border of Pronator Terrace. This Pronator Terrace, this is the medial border of Pronator Terrace, and this is the lateral border of Pronator Terrace. Now the lateral border, let me use black. The lateral border is formed by the brachioradialis. And the part of that's brachioradialis running down. That's brachioradialis. Now the part of brachioradialis forming this relation is the medial border of brachioradialis. So the lateral border of cubital fossa is formed by the medial border of brachioradialis. Now, for the upper border, we've already said that it is formed, which we said is also called the base. And we said it is formed by an imaginary line. This imaginary line ran from the lateral epicondyle to the medial epicondyle. That is what has also been shown in this diagram using the dotted lines. The base is shown in these diagrams using dotted lines. Now we'll look at the floor. The floor is formed by 2 main muscles. These muscles are the supinator and the brachialis. So for the floor, we're looking at we're looking at the floor. The next diagram here gives us an idea of the floor. Already we are picking out, if you can pick out the brachioradialis, that's the lateral border, and we're picking out the pronator terrace, that's the medial border. The next two muscles form the floor. One is brachialis on the upper and medial side, and then the other is the supinator, which is seen on the inferior and lateral side. So the two structures that form the floor are one, we have the supinator. Supinator is on the inferior part of the, is inferior, and also is in the inferior lateral part. The supinator is in the inferior lateral part. Now the next muscle forming the floor, as we said, is the brachialis. And this is in the supromedial part. So these two structures form the floor, as you can pick from this diagram. Next, we look at the roof. The roof of the fossa is formed by skin, superficial and deep fascia. It is first formed by one for the roof. It is first formed by skin. It's also formed by fascia, superficial and deep fascia. The next structure forming the roof is the bicipital aponeurosis. Bicipital aponeurosis is the distal extension of the biceps brachii muscle. It has two extensions, one to the radial side where it's attached to the radius, the other to the ulnar. Its attachment to the ulnar is via this bicipital aponeurosis. Also, forming part of this structure in the roof is the median cubital vein. Median cubital vein, which is part of, which is running along the bicipital aponeurosis. The median cubital vein is seen connecting the cephalic vein to the basilic vein. So after the median cubital vein, we see the next structure, the nerves, all the cutaneous nerves in the forearm, both the medial and the lateral. So we also find them in the roof. So we have number 5, we have the medial cutaneous nerve of the forearm. We also, number 6, we have the lateral cutaneous nerve of the forearm. So these 6 structures are seen forming the roof. We'll look at our diagram for the roof. In this diagram for the roof, this is the medial side, and then this is the lateral side. So we can pick out some of the structures we've already listed in the other section of the board. Let's start from this point. At this point, we'll see the basilic vein. Then at this point, we'll see the cephalic vein. And then we'll see the median cubital vein connecting the cephalic vein to the basilic vein. So this is the median cubital vein. The median cubital vein. Now, the next structure we've also noted here forming part of our roof is the bicipital aponeurosis. That's what we already have. Bicipital aponeurosis. Bicipital aponeurosis will separate this, the vein and the cutaneous nerves from the deep line structure, that is the median nerve, and the rest of the other structures. So part of the structures we'll see here will be the cutaneous nerves. This one on the medial side, the medial cutaneous nerve of the forearm. If you can recall, there's a direct branch from the medial cord of the brachial plexus. At this point, we are seeing this other point, we are seeing the lateral cutaneous nerve. We are seeing the lateral cutaneous nerve of the forearm, which is actually a distal continuation of the musculocutaneous nerve. So this, we are seeing the two nerves, the two cutaneous nerves, the lateral cutaneous nerve of the forearm. we're seeing the medial cutaneous nerve of the forearm, we're seeing the medial cubital vein. We see the bicipital aponeurosis separating the rest of these structures from the deep contents. We also recall, we talked about the floor. When we talked about the floor, we said for the floor, remember we recall, we said we had the supinator on the inferior and lateral side. We saw the supinator on the inferior and lateral side, and then we also the supinator on the inferior and lateral side, and the brachialis on the superior and the medial side. Brachialis on the superior and medial side. At this point, we saw the pronator terrace. That's pronator terrace. We saw the pronator terrace at this point, and then we also note the brachioradialis at this point. So for the floor, we are seeing brachioradialis. We are seeing brachialis superiormedially and supinator inferiorlaterally. So the next thing we'll be looking at will be the content. For the content of this fossa, we'll be using a simple mnemonic to remind all of us of the content. We'll use a simple mnemonic, MBBS. This is a mnemonic for the content of the structure of this fossa running from the medial to the lateral side. The diagram we already have here has already given us some of these structures. From medial to the lateral side, we'll see the first M we have here is median nerve. We see the median nerve. The next structure, the next B we have here is the brachial artery. The brachial artery. The next we have here is the biceps tendon. The biceps tendon. And then the last one we have here is the superficial branch of radial nerve. So let's try to identify some of these structures. At this point, we see in this diagram, we see the median nerve. That's the median nerve. This is medial, and then this is lateral. So this is median nerve. The next structure following it is the brachial artery. Followed by the next structure, which is the biceps brachial tendon. And then if we go deep, now the next structure, that is superficial branch of radial nerve, is actually overlapped by brachioradialis. It's not as clear as it is in this diagram. It's overlapped by brachioradialis. In fact, in life, you need to pull brachioradialis a little laterally to be able to see the radial nerve, superficial branch of radial nerve. So that is radial nerve at this point, superficial branch of radial nerve. So how are these structures running? Let's look at how these structures are running. The median nerve actually is running to the forearm. It's running to the forearm. And at this point, this is the pronator terrace. The median nerve is going to enter between. We have two heads of pronator terrace at this point. We have two heads of pronator terrace. Now, the median nerve at this point will pass between the two heads of pronator terrace to enter the forearm. Then we're seeing this point. At this point, we're seeing brachial artery. The brachial artery in the fossa divided into its two terminal branches. That is, one, the ulnar artery, and two, the radial artery. What the ulnar artery did here was to run deep to the deep head of pronator terrace. That's the pronator terrace, the superficial head, the deep head. While median nerve passed between the two heads, the ulnar artery passed deep to the deep head. At this point also, we see the median nerve crossing the ulnar artery. Now the next structure we'll be seeing here will be the radial artery. Radial artery actually ran under the brachioradialis. Radial artery ran under the brachioradialis. As it went down, the full detail is seen in our video on the blood supply to the upper limbs. Now, at this point, we also see the tendon of biceps brachii as it went distally and downwards to be inserted into the radial tuberosity. So this actually we see the radial nerve too, superficial branch of radial nerve. At this point, the radial nerve had given off its two terminal branches, the deep branch, which is also known as the posterior interosseous, and the superficial branch. This superficial branch will actually run with the radial artery, both of them lying overlapped by the brachioradialis as they move distally, with the radial nerve, this superficial branch of the nerve, running lateral to the radial artery. The next thing we'll look at will be just the applied anatomy. Now, when we want to take, we've noted that the most effective place to take the brachial artery pulsation is at this point, at the point of the radial, at the point of the cubital fossa. This point, the exact point referred to here, is the point that is medial to the biceps brachii tendon, which is also easily assessed. We also noted that when we want to take venous blood, or we also want to do intravenous injections, the vein of choice that also is easily assessed is the median cubital vein that's also assessed at this point. This is the much you can take on cubital fossa. Thank you very much.